As we all know, it's impossible to stop the aging process, but thanks to plastic surgery, we can slow it down a bit. This morning, our series, A Stitch in Time, examines procedures for women in their 40s. After years of thinking about it, Mary Ellen Tortorello decided that it was time to put the sparkle back into her eyes.
I'm all set. Can't wait.
When Mary Ellen Tortorello turned 40, her face began to change. It was a turning point for her in more ways than one.
I did Botox because that helped erase some of those bad wrinkle lines.
Now 45, Mary Ellen says her eyes, bright and perky in her 20s, don't reflect the woman she is today.
Then as I was getting closer to my 40s, those bright eyes were starting to get an overhang. And I'm doing a side thing in the mirror. I'm happy a lot of the time, but the eyes just weren't showing it.
Well, Mary Ellen's problem is that she feels she looks tired, and she doesn't feel tired.
The solution? An upper eye lift. Connecticut plastic surgeon Joseph O'Connell says at least 90% of his patients have eyelid surgery. It has become his most popular procedure.
Eyelid surgery is really the first step in facial rejuvenation because it's really the first part of our face that shows the aging process.
The surgery is considered minimally invasive. Mary Ellen was given a local anesthesia. She remained awake and chatted through most of the surgery.
So it's not upper, it's just a slight incline.
When it was over, a slightly swollen Mary Ellen was on her way to recovery and knew she'd made the right decision.
Very good touch. I recommend it to anybody who's thinking about doing it. Don't be afraid. It's a piece of cake.
Beautiful.
A piece of cake. All right, that was 2 weeks ago. Here she is this morning. Da-da-da. Mary Ellen Tortorello here along with her surgeon, Dr. Joseph O'Connell of Bridgeport Hospital in Connecticut. Good morning to both of you.
Good morning.
So you do have bright eyes.
They are bright and sparkly once again.
They are. So do you feel that it was successful? Did you get your bright eyes back?
Bright eyes are right here.
Wow. I cannot believe that you spoke to the doctor through the whole surgery. You didn't feel anything?
Little tugging, but mostly relaxed, very easy. I was in good hands.
Right. And afterwards, what was the recovery like? What did you look like? Was it painful?
Well, you can see right there on the tape that that was the worst of it right there.
Really?
And technically, I was back to doing normal things within 36 hours.
Wow, that's incredible.
Yeah.
Everything, right?
Yeah.
Exercising, all of that.
Well, exercising a week later, but just normal daily routine.
How far along is she in the healing process, Dr. O'Connell?
Mary Ellen is now about 90% of the way there. She still has a little bit of residual swelling, which will go away. And as that dissipates, her eyes will open up a little more, and she'll even look a little bit more awake.
Wow. Now, what is the actual process that you do, if you can, in layman's terms? Tell us what you do to achieve that one.
Well, with an upper eyelid or a blepharoplasty, what we do is we make a small incision that's designed to fall right within that natural upper eyelid crease, and we remove that hanging fold of skin, which is called a hood, which blocks our vision. It really makes us look older and sometimes more tired. And then along with that,
take the skin out.
Yeah, we remove the skin, and then along with that, we often take a little bit of puffiness, which is due to fat.
Right, the fat. A lot of people have a fat problem underneath their eyes, right? They have that sort of swollen, puffy look underneath. And so there's also a lower eyelid surgery, correct?
That's absolutely right. In fact, the lower eyelid is very similar to the upper eyelid in that plastic surgeons tighten and remove loose skin, and we try to efface some wrinkles. But in the lower lid, the bagginess, which is due to fat, takes on a much greater role.
That's something that's really hard to cover. You can't cover it with makeup or anything like that. So what do? You actually suck the fat out of... why am I demonstrating this with my fingers? But you actually... What do?
Well, you can't
without getting too graphic, but how do you get the fat out of the lower eyelid?
There's two ways to do it. One way is to make a very small incision right along the lash line and very carefully remove the fat. It's far too dangerous to suck it with liposuction.
Okay.
Or the other way to do it is to actually go through the internal aspect of the lower eyelid, which is advantageous because there's no scar produced with that technique.
Right. How much are these procedures?
They're roughly $3,000 for either the upper eyelid or the lower eyelid, approximately $6,000 for them together.
Does insurance ever cover it?
Sometimes insurance will cover the upper eyelid procedure if there's a functional issue involved, which of course is blocking vision.
What sort of feedback have you gotten?
Oh, very positive. In fact, my daughter, when she walked in from school the other day, she looked up at me and went, "Mom, your eyes are so bright again. I can't believe it."
Oh, that's great. That must have made you feel good, like you made the right decision.
totally right decision.
Now, is she going to have some maintenance down the road here in terms of more surgery in 10 years or so?
Well, we can't stop the aging process, but in terms of the upper eyelids, there's really no maintenance required. This will probably last her close to the rest of her life.
And what percentage of your patients, you said 90% get this procedure. How many are men? Are they getting this done?
This is a procedure that many men do have. The reason that about 90% of my patients have it is because when I do facelifts, just about everybody has their eyes done because the eyes are really the first part of our face that ages.
Oh, yes, the first thing to go.
Right.
Are you done with plastic surgery?
I can never say never.
Aren't you doing something tomorrow?
Oh, a little photo facial, get rid of those age spots.
Oh, boy. Okay, Mary Ellen Tortorello, Dr. Joseph O'Connell, thanks so much.
Thank you.